we're excited to have actually two students speak to us about their experiences with you at Hackensack Meridian Health. So this has been a wonderful example of a great partnership. So first, I'd like to introduce Rhee. Jay is a student at Bergen Community College. Hi, Jay.
Hi, good morning.
Thank you for
for
joining
letting
us.
me, thank you for actually sharing this opportunity. So my name is Rhee. I'm a senior student in the respiratory care program at Bergen Community College. I'm also an employee at Hackensack Meridian Health, located at the main campus in Hackensack, New Jersey. I work in the main pharmacy as a pharmacy technician, and I've worked there for 5 years. Prior to that, I was also a IT consultant / business owner. During the years where I worked in main pharmacy, I went into pharmacy technician by studying a textbook on my own and taking the exam. Didn't have any clinical experience. So the experiential learning that Matthew was discussing, I never got that until I joined the respiratory care program. And I got to see both perspectives. When I did the pharmacy technician studying, I didn't have the experience. And when I got into the work field, it actually was overwhelming, I would say, because you get your textbook knowledge, but you don't get to really perform and try it out until you go into the workforce. And if I had a clinical experience, as I have in respiratory care in the respiratory care program, I think I would have done a lot better, and it would have been a smoother transition, and got to understand how the workflow is, how who the director, if I fit into the department. With that said, in my 2 years in this program, I was given the opportunity to attend several clinical sites in a number of hospitals that we are, I guess, collaborating with the school. And I was able to meet the directors, meet different instructors who work in the facility. I was able to meet with the other respiratory care practitioners, and it gave me an opportunity to see if I would actually like working there. I would, and they were interviewing me, probably watching me, how I work, how I interact with the patients. And it gave me a great opportunity to see what I learned in school and how to implement it with different machines, different technologies that they use. And I think it's a great opportunity if any student gets to go to any of these clinical sites. So you get to really interact instead of just learn through your brain and through reading. The workflow, how the respiratory departments work with other departments, I think is a great opportunity for students to learn that way. And if more hospitals join in, it'll be great. And it's, to me, I think that's a great experience that you can never do it on your own. So I think one thing that I wish I had when I was younger is that maybe more openings in the high school, and because I didn't know about these like other positions except for doctors and nurses in hospitals. It's really not a talked about field. I only found out through a friend of mine who became our respiratory care practitioner, and I learned it through him because he was attending the same program.
Thank you so much, Jay. I think you are the true example of what experiential learning means and what it does for someone, and giving them the confidence and things of that nature. And we're so happy that you were here to share your experiences with us. So we really thank you for coming on and talking to us, because we know that sometimes it's hard to come on and take some time away out of your day. So we appreciate you sharing your experiences. And if anyone has any questions for Jay, you can put them in the chat. But you're an example of why we need to have experiential learning, and also why we need to start talking about career exploration earlier in the high school years. So thank you for joining us today. And I'm going to move over to John Torres, who is a student at Middlesex College. John, if you could share your experiences with Hackensack Meridian, we're so happy to have you here.
Good morning. My name is John. Everybody calls me Nito. I am actually a phlebotomy student from Middlesex that I had achieved through the PCT apprenticeship program that Hackensack Meridian offers. Prior to that, I was a fireplace installer and technician for nearly 20 years. better part of my life, basically. And the apprenticeship program was brought to my attention after COVID had hit, and jobs were just either getting shut down or you worked in the medical field. And as Jay had mentioned, when you go to the hospital or you go to a doctor, you only see doctors and nurses. You don't really know anything else that's going on behind the scenes. So what the apprenticeship program actually offered me um, was I call it a crash course. It's nothing like a crash course, but you have 2 weeks where the first week they teach you, all the book stuff that you need to know, when it comes to policies and HIPAA and some of the devices that you have to use when you're out in the field and everything like that. And then the second week, they really focus on the skills aspect of it, how to draw blood, how to do manual blood pressures, how to work the Dynamaps, patient care, being really involved when it's yourself to the patient. After that, you have approximately 6 to 8 weeks where you're hired by a unit. They bring you in, and I work over at Riverview Medical Center, and my unit is complex care. And I couldn't have asked for a better team to get brought into, especially being new in the medical field, and going from something that was totally like day and night. Yeah, customer service is one thing, but patient care is a totally different thing to get brought into. So with absolute zero medical knowledge and experience in the field, by the time I stepped onto the floor for the first day, that apprenticeship program, that first 2 weeks, gave me that little bit of an edge that, hey, I can do this. And then by the time I got done with the 8 weeks of being on the floor, having my preceptor teaching me the ropes and, doing it myself, the confidence level that I achieved when I got out of the 8 week orientation was unimaginable. And the one thing that I can attest for is I'm a firm believer in the see, do, teach theory. You see it get done, then you do it with, somebody helping you out. And then by the time you're done doing it, you're able to teach what you know. You have that confidence to go in there and teach everything. And Middlesex, with this apprenticeship program, Middlesex really helped out because they did do that partnership where they have the phlebotomy course. And that was an 8 week long course. The instructors over there, Annie Pratt's, she's amazing. I was in constant contact with her because, again, right out of high school, I went right into the fireplace industry. So it had been almost 20 years since I did any type of schoolwork. So she was very helpful. And with the programs, I was able to get my national certification as a phlebotomist. And now I'm able to go out on the floor, and if somebody needs help with a blood draw, I have that confidence. I have that. I know how to do this. I know, here, let's do it this way. So it's very beneficial. I couldn't have even imagined being in the position that I am today. I'm coming up on 1 year with Riverview, and it's been amazing. It's been a journey. It's great to, really grasp a new career. And again, I couldn't have imagined it being any better.
Thank you so much. That hearing your story is just amazing, right? And I think it, again, that resounding thing that we keep hearing is about confidence, right? That experiential learning builds confidence, and it helps build, especially in the healthcare industry, right? When you're first posed with a patient or you need to do something. So I thank you so much for coming here and joining us and telling your story.